To be honest, there was one bit which he did waffle on, which was evolution.
Yeah.
Hey everyone, Sean here, and welcome to episode 2 of Quarantine Conversations. I think during my self-isolation, I thought it would be nice if I recorded some of my conversations with my friends. And the first one up here is Mark. He is a second year chemistry student, and we'll be covering a lot of scientific topics, so hope you enjoy. To start off, do you want to introduce yourself? Where you study, what you study, and just, yeah.
Okay, my name's Mark. I'm a second year chemistry student. Yeah, that's it.
2,000 years later.
I think today I really want to know more about what's your view on science, since you study a science degree at university. And I think especially during the COVID crisis, we often see governments, especially the UK, as we both know, that they always say, or even in the beginning and still now do, that they're guided by the science.
We are being guided by the science. We'll be guided by the science at all times.
We followed the science throughout this, building on that science.
I mean, I find it very preposterous. I mean, how would you find it? I mean, as a person aspiring to be a scientist themselves.
Yeah. Well, when I first decided to do science, I guess the idea of studying matter and science, study of sort of like actual things and how things actually are, really interested me. I think that the trouble with science portrayed in the media, I think, is quite a problem, because it's often portrayed as objective truth. Well, that is the case for a lot of science. That's not the case for some things, and I think we've seen that in the recent crisis, that the media has portrayed contradictory things, such as if you take masks, for example. BBC would interview people, and they would release information saying, one doctor said that told the BBC News that routine surgical masks for the public are not an effective protection against viruses or bacteria carried in the air. This was released, I think, around February time, and now, around now time, the BBC is telling us to wear masks, and from the 15th of June, it's compulsory to wear masks, even. And science seems to be saying something different to how it was 3 months ago. And I think the real source of the trouble, I think there's a difference between what is objective truth and what are sort of the correlation of facts, and what is sort of a well substantiated interpretation.
I mean, now you talk about it, when you talk about the mainstream media, I feel as though most people who are journalists, who are in the media themselves, mostly have done a humanities subject, right, in university.
Yeah.
And therefore, I'm not saying they don't socialise with people who do sciences, which is clearly not the case, right? This is an example here. But they're very much embedded in the writing, the analysis, the economics, or the histories and the philosophies, and they have this kind of really bad perception of, not bad, but inaccurate perception of science.
Not entirely true, yeah.
And so, do you think that's maybe a big factor of why this is portrayed then?
Yeah, I speculate whether actually, people who have studied humanities subjects, that is the cause for this idea. I think a lot of the journalists make the same mistake as the general public do, and the general public make those mistakes because of what the journalists say. Because I think that journalists take a lot of science, or they see studies and they go, "Oh, this is fact." They give it to the rest of the public. The public see this as fact. Whereas this is not the case. Research in science is often, you have you have a theory, and then you go out and get the results to try and fit that theory, and sometimes it won't fit that theory. And although you sometimes get correlation for some results, I guess one of the things you're taught in school actually at A-level is correlation does not prove causation. But I think what a lot of journalists do is they'll see a specialist say something, and they'll treat it as fact, whereas it's this specialist's opinion based on what they know, which is a well-substantiated explanation, and which very much could be true, but in a lot of cases it's not actually true. Fact is, in science, means the data that you get, the data.
I kind of get it. What you're trying to say is that the data you get is a fact, okay? But then the interpretation, how you want to interpret it, that's the science. That's the essence of science,
exactly.
Right?
There's these two parts in science. You get your data in science, which is the facts, and then scientific theory is a good explanation of the facts, which the scientists come up with based on the data that they come up with. I mean, if I asked the average person on the street to explain the theory of evolution to me, I'm not sure that they could do it, but I think most people would trust it as fact, when actually what it is at the moment is something that is a good explanation for what scientists observe to be going on. And I think part of the problem is that journalists misinterpret it and they give that to the rest of the public, and this is what this cause of the misinformation of things.
Coming from, I think, a historical perspective, people who do, I think, humanities, we tend to praise science, we applaud science as this kind of more noble, more objective way of thinking. So, I mean, okay, just going back to, of course, this topic about guided by the science. I mean, how would you rate the government's performance then, the UK government?
I'm not gonna lie. If you asked me about 3 months ago, I would have praised the government. You know, they were fast.
So this was before the lockdown, or just when the lockdown was imposed?
Yeah, just before our lockdown. When you look at a lot of other countries going into lockdown quite rapidly, the UK government was criticised for delaying its lockdown, and I thought to myself, and everyone's criticising the government. I thought, well, you know, the government is listening to these specialists who are specialists in public health and clearly know what they're doing, because you know they're scientists and they know exactly what they're doing. And you know, even myself as an aspiring scientist, I was guilty of putting sort of absolute faith in that. And I thought, you know, the UK is going to come out on top because these specialists know exactly what they're doing. But actually, what you've got to bear in mind is, although these people are probably experts in public health, the last sort of global pandemic happened sort of 100 years ago with the Spanish flu, which killed millions of people. So these scientists would never have actually experienced an actual public health crisis. I mean, bar HIV, but that's I think that's a sort of a separate thing. But the point I was making is that right now the UK has got one of the highest coronavirus number of cases, and we've had, including care home deaths, we've had a lot of deaths. And
I think including care home deaths, it's up to around 80,000.
Yeah, it's a lot. It's a lot, and you know, as much as I did put my faith in public health specialists before, I think basically what I'm saying is I think the government's incompetent. I think the decisions they made were wrong. I think they listened to specialists, which they should have done, but I think to an extent, I don't blame the government for sort of listening to actual public health specialists, because they're listening to science, they're listening to their best source of knowledge. However, evidently they were wrong. And I think if I was to criticise the government, perhaps they did put a bit too much faith in science, because science has ultimately let us down.
Science meaning the public health officials, yeah?
Yes, yeah.
Yeah. No, because I think it wasn't until a month ago, maybe a few weeks ago, when the public health officials then came out and said, oh, sorry, we actually actually modeled the whole thing as an influenza as opposed to a coronavirus.
Yeah.
And because of that,
Really?
therefore, sorry, like this happened and all that. But no,
I
can you tell a bit about your experience, or because I know your sister is working as a junior doctor at a ward.
Yes.
I mean,
Yes,
how does she see the situation? And
in Paul Hospital.
yes,
she has seen some pretty horrible things. I could tell you some horror stories. There was one there's one particular case that struck me because my sister was working on the coronavirus ward directly at Paul Hospital. One of the problems with social distancing is she had a dying patient, and she asked the patient if the patient had any family. The patient said yes. They called the family. Unfortunately, the family couldn't come visit because of social distancing measures. My sister had to hold the phone and sort of stand there awkwardly. She felt like she was intruding on this family's goodbye time, and she had to stay there holding the phone while this patient was saying goodbye to his family.
you earlier told me that she was one of the only doctors who never got tested positive in her hospital.
Yeah. Yes. Yeah. That's correct. Yeah.
So what was the situation of something like the PPE, the hygiene, the system in that hospital?
Okay, so she wasn't one of the only ones in the hospital not to get sick. She was one of the only ones in her ward not to get sick.
Okay.
So there's probably other people in the hospital not to get sick. But because she was working on the coronavirus ward herself, she was at the most risk. From what I've heard, the PPE was pretty terrible. I mean, they don't even, a lot of the time, I think for a lot of the time she didn't actually have even a surgical mask when she was going around. There's patients sort of coughing on her, and she has to sort of hold her breath. And if I'm honest, I don't know too many details, but I have been told that there was a lack of PPE. Fortunately, because she was at a hospital that's near the coast and not near a big city, the hospital actually never went beyond full capacity. It went up to full capacity, and it was very busy at some times, but it has gone down quite a lot. One of the other problems actually she mentioned is, and you would have seen this in the media as well, is that a lot of doctors have been reallocated from other areas of the hospital, such as surgery and medicine, to the coronavirus ward. And what you actually had was a lot of the coronavirus wards were overstaffed, and you often had sort of 3-4 specialists surrounding a bed, wondering what to do. And there was a lot of doctors in the ward sort of like needing stuff to do. And as a result of this, a lot of patients who had other illnesses and whatnot passed away, and you saw that in the media. Statistics for other illnesses increased, and I think part of the problem is, I mean, I personally blame NHS management for listening to the media, because what happened is the coronavirus wards were overstaffed and other wards were understaffed, and as a result, a lot of people who had other illnesses died.
I actually have a friend who was staying in London during the lockdown, and he somehow got a job. I mean, he does economics and management, okay?
Yeah.
And he got a job to work at, the NHS Nightingale Hospital by the Thames. And he told me about it, and I asked, okay, so what's the work like? Like, are you often going over hours, and how are they treating you? And he said, because what he did was he had to disinfect ambulances.
Yeah.
Okay.
Yeah.
So doesn't require any medical degree at all, right?
Yeah.
And he said, no, it's great. He has to work 4 days a week, of up to 48 hours. But often he basically says he really had nothing much to do, and there weren't a lot of hospital patients. And I think to some extent it was kind of overstaffed. I actually had an appointment made back in December. Somehow then the appointment was scheduled to be on the 4th of May.
Oh, yeah.
And somehow once it got to around the end of April, they texted me and said, okay, sorry, your meeting, which is at the University College Hospital, okay?
Yes. Yeah.
It was cancelled.
Yeah.
And then I remember specifically receiving that letter in January, when it said, okay, your appointment's on the 4th of May. And then at the end of the letter it says, please do not miss this appointment. Missing it would cost the NHS £160. I mean, of course I'm not going to miss it. And then somehow they had to cancel it. I mean, It is just absolutely unbelievable.
Well, I think
I'm going to just move the conversation on to science and education, particularly in primary schools and secondary schools. Because I feel as though how the society views science, particularly, I think, because through this kind of humanity-based media, we often have an inaccurate perception of it. I think maybe the question to start off is, when should we teach people the limitation of science? Possibly, let's start from the top.
The limitations of science.
Because we often see it, or at least me, who does history, is that we often see science as this something that is very noble, very objective, very accurate, because of the data they can scavenge, right? Yeah. And we marvel at it.
Yeah. So I think, in terms of teaching people the limitations of science, I think the level of science that you learn at primary and secondary school, all of that is hard proven fact. And I personally don't think you should be teaching anyone the limitations of science at school in that respect. However, I would like to make a point that there are a lot of simplifications at school for science, and science is often portrayed as sort of simplified ideas about.
But do you think it's oversimplified for children then?
I actually don't think it's oversimplified. I think it's necessary to simplify it to that extent, because I think a lot of concepts in science are conceptually very hard to understand. So simplifying it for young children to understand is a good thing. If we just gave all of science, or we made science, we didn't simplify science at school at all. I think what would happen is a lot of people would be disheartened and disinterested in it, and because it would be too complicated.
But what do you think? What do you think about the view when, of course, I think just a very rough example, we remember all this information, like how many planets there are in the solar system. We're in a galaxy called the Milky Way. The Earth revolves around the sun, and the Moon revolves around the Earth. Do you think in primary school we already should be sort of asking or telling the children the questions we still don't know? Something like, why is the Earth sort of axis is tilted? Or kind of, what do we not know about dark matter? Or something like that. That holds this solar system on itself. Because I think by doing that, you are injecting interest, right? Am I not wrong by saying that?
I think there is an argument of that in terms of sort of, because dark matter, obviously, people don't really know much about dark matter at all. I think there is an argument to be said that by educating children on the big questions of science today that science hasn't proven science is working on, I think that can spark interest. But the main reason why a lot of these sort of concepts haven't been directly proven or haven't properly been discovered, like dark matter, is because they are very, very complicated, and even the best minds on the planet can't even crack them. So I think it would be too complicated to talk about the limitations of science at such a young age. At the same time, I think it might be good to gain an awareness of that, so people don't sort of treat the well-substantiated interpretation of fact that science makes today that isn't necessarily objective fact. I think it would be good to educate people on the limitations of science, because I think it would be good to see how science is where science is and what we can do in the future, and I think that can be quite inspirational as a small child to see. Whereas I think what happens a lot in schools is we're taught a lot of stuff that was proven to be true as facts about 200 years ago or 100 years ago. A lot of what we do at school is not necessarily interesting. So
what are some of the facts you would say you would like to be seen that have been proven recently? Okay, let's say in the last 100 years, would you think should be in the curriculum? Like, just on the top of your head.
I think we should educate people more on drug development and sort of the process of that, and sort of the process of legislating that, and how people sort of design drugs, and sort of produce drugs. I think although it's a very complex process, I think we can educate people in a more simplified way to create a greater attraction for science.
I was just going to ask, so does that mean, or did you feel as though there was a huge disparity in the mindset or the kind of mentality science was kind of being taught in university and, let's say, in the A-levels then, when you made that jump?
Yes, I think there's a huge difference in mentality. I think the issue with teaching sort of science at school is you're very much taught how to answer an exam, answer a mark scheme.
Even in A-level?
I mean, even A-level, you learn the start, you learn the theory, you go, okay, I've got the theory, but the majority of the learning comes when you do the exam practice and you get into the mind of the examiner. I personally think to an extent you do have to there are standards that you have to meet to pass something or to get to demonstrate a competency in something. However, I think the science at school is very, very mark scheme orientated, and I think what should happen is possibly it should be a bit more open-ended. For example, at university, we don't have mark schemes for our exams. There is a reason for that, because lecturers they mark your exam based on how you approach the question. What understanding have you shown of the question? What are you thinking to solve that question? And I think this is a mentality that we should be driving at school. It's about what makes a good scientist is the correct mentality. I think what mentality do you have, rather than your ability to recall what was on a previous exam paper based on a similar question that's come up this year.
So are you saying that even the skills you've developed in A-level are just, I wouldn't say inadequate, but just irrelevant to in university?
Irrelevant. I mean, in terms of the theory that you learn at A-level, I think it's absolutely relevant. I mean, I don't think you could do a chemistry degree without chemistry A-level. I mean,
okay.
Or having done that, it's just a fact. You do need that baseline of knowledge. I'm just saying that the focus of university is I'm learning how to become a scientist. I'm learning how to do chemistry. Whereas at school, I was very much learning how to do an exam rather than actual chemistry itself. So I wouldn't say science, or in general, as a subject at school is inadequate, but how they assess it and what they get students to focus on, I would say, yes, that's inadequate.
So how would you, I think just off the top of your head, like how would you change it then? Would it be, of course, you talked about changing the mentality of it, but I think how should it be assessed then? Because I feel as though in secondary education there's still a lot of people doing science, so that there's already a lot more people doing it than in university, and of course the class sizes are larger, I assume so as well. Yes.
Yes. Yeah.
And so there must be a kind of benchmark, right?
Yes, I would. What I would say, it is tricky. So I don't think if we were to use, to implement a sort of a university style of teaching at school where we're teaching people the mentality, you don't have a strict mark scheme. I think that would be quite difficult to implement nationwide because of the amount of people taking the subject, and we wouldn't be able to directly sort of just use a university mentality at school. I think in that respect there is an argument for having a mark scheme, but what I would say is I would say that we need to put a bit more subjectivity into science at school. How I do that specifically, I don't know. But for example, I know, when I took A-level biology, there was a lot of questions about DNA and how sort of DNA is made and proteins made, and there was often sort of 5-6 markers on it. And if you didn't say sort of the exact wording that they did, you wouldn't get all 5 marks. And if you didn't say sort of one word that they wanted, you would get no marks. I think that in my opinion is wrong. I think they have got polarized too far in the direction of mark schemes. It's difficult to say, because there are a lot of people taking science A level, and you do need to get a level of competency, and having too much leniency would possibly allow misinterpretations to happen.
Yeah, no, don't worry. I'm not asking you to change the world now. Thank you for your time. I think I've really enjoyed it. I've really learned a lot more stuff.
I enjoyed our conversation too.
Cheers. Because what you said yesterday about studies disproving other studies, which we did talk about like briefly.
Yeah. Yes,
I feel as though it might be better if you could give a specific example. Do you have one in mind that you could talk about? Or...
So I can, off the top of my head, I remember a really good one is about 3-4 years ago, and there was a huge thing about fish oil. And how that was really, really good for the brain. And there were several studies saying that fish oil tablets specifically were really good for a brain. And to be honest, I believed it. My mum believed it. I used to take fish oil a lot. I used to genuinely believe that it was somehow improving my brain by some sort of scientific mechanism. And then 2 years later, I see sort of about 4 or 5 studies saying that fish oil tablets have been shown to do nothing.
How about the real fish oil? Let's say in canned sardines or anything like that.
I don't know about that. I think, I mean, I would, in my opinion, I would say it's probably good for you and probably good for your brain. But again, that's not fact.
Fair enough. No, I actually got the same thing, because last year, I had to help out a person who was doing nutrition. And she sent me a bunch of notes which talked about how, okay, I need... Clearly one of the deficiencies I had was I didn't have enough fish oil in my system, because I kept eating a lot of different kinds of meat, but then I wasn't having any fish in my diet at all. Okay, so she said, okay, if you're not actually eating a lot of fish, because I never really would eat it in the UK. She said, okay, I'm going to sort of recommend you some fish oil sort of tablets you can have daily.
Yeah.
Or instead of that, just please have some canned sardines, especially keep the fish oil. Keep the fish oil. That was the main bit. And so I sort of did follow it. And I mean, radical transformation, I don't know. But I think maybe it's been kind of, I wouldn't say exaggerated, but it's been put too much in the spotlight, maybe.
Yes,
because
I think
the
so.
essence,
I think that's
the essence. Well, I don't know. I'm no scientist, but the essence of survival is water, right?
Yeah.
And carbs and vegetables, for the fiber and all that. So this could be. I would say it's a supplement. It's a complementary feature, but it's not. It's not compulsory.
No, I absolutely not say it's compulsory, and I would even challenge it as a supplement, to be honest, from what I've read. But to be honest, I'm not going to stand up here and make the same mistake and say fish oil isn't good for you. We've had scientific studies that have said 2 different things across the years, and both are seemingly to be facts. So what do you believe? I think you've got to sort of read the papers and make sort of scientific thing. I would say that I don't think taking these things on you, but I wouldn't treat it as fact that these things are going to improve your IQ or something.
Yes.
Not that they did say that improve your IQ, but that was just as a joke.